Hello, everyone, and welcome to today's session. I'm Prachi, head nutritionist and lifestyle expert, and head of cancer vertical with Team Loop. Today, we shall discuss about why do you commonly experience gut issues as a side effect of chemotherapy, and how can we handle it in a much better way. So, when one has cancer and is undergoing either chemotherapy or radiation, it quite commonly happens that the person may suffer from gut issues or digestion issues like constipation, diarrhea, nausea, vomiting, etc. Have you tried to get to the root cause of why does this happen in the first place? Now, when we talk about chemotherapy or radiation, it is not entirely specific only the tumor cells, meaning usually these treatments are designed to attack tumor cells which are fast growing and dividing. But in that, chemo radiation can also affect other normal cells of our body which are fast growing, which includes the cells lining your digestive system, right from the oral cavity, that is your mouth, to esophagus, intestines, till the rectum. Also, hair follicles, which are fast growing, they are also fast growing, and hence, we do see hair loss also as one of the side effects of such treatments. Now, coming to how can we deal with such digestion issues, gut issues during treatment in a much better way. To begin with, let us understand what are probiotics. Due to the treatment effect, especially, because of chemo radiation, usually good gut bacteria, which are the probiotics, they tend to get affected and flushed out of our intestines to a good extent. Now, these probiotics are very important to keep up with better digestion. Hence, it is best to replenish these probiotics. Now, what are the natural sources? There is rice kanji, which is probably the simplest of natural source of probiotic that we can have, or even fermented foods like idli, dosa. These are a good source of uh, good probiotics. In fact, rice kanji is the simplest that we can make is how we can make is using rice, which is take about 1 to 2 tablespoons of cooked and cooled rice, cooled at room temperature basically, and then soak 1 to 2 tablespoons of it in water, either in a clay pot or a steel vessel, and soak it overnight, and the next day eat the rice and have the water in which they are soaked. So this is the simplest, form of probiotic that you can have. In fact, considering the effect of the treatment, you can also, in fact, check with your doctor, and if need be, can start with a good probiotic supplement to support your gut function further. Now, as we require, as humans, we require food for energy. Similarly, even probiotics require something called prebiotics for their functioning. And prebiotics, the examples are, onion, garlic, oats, apple, and so on. So we need to provide these also through our food, for the probiotics to nourish well. Okay. The other thing, the other thing that we need to consider when it comes to gut issues is vitamin deficiencies. Because of the treatment effect, many vitamins tend to get flushed out. There are deficiencies of vitamins, especially B complex is also something that we need to look at, and they are very important for gut health and healing as well. So, to replenish them, the natural food sources are either whole grains, legumes, beans, chickpeas, kidney beans, fresh green leafy vegetables, which are all rich in B vitamins, can help. You can have them either in the form of soup, porridges, and so on. So, you can also check with your medical practitioner, if a B complex supplement is needed in that case. Now let us look at specific issues. So firstly, constipation. Now when constipation occurs as a side effect of the treatment, it can be, of course, apart from being a side effect of the treatment, it can also be due to low food intake and thus less fiber intake. not drinking enough water and fluids, physical inactivity, or even due to certain pain medications or iron supplements, which are given during treatment that can cause constipation. In fact, even depletion of vitamin B3 during chemo can lead to constipation. Now, the first and foremost thing that we need to look at is to keep a check on your water and fluid intake. It should be around 2.5 to 3 liters in total, but of course, there are exceptions. If there are any, restrictions, any water restrictions given by your doctor, you need to abide to those restrictions. The other thing is do not gulp your water. You need to sip it slowly and avoid with meals. You can have 30 minutes post your meals, but avoid it with meals. The next aspect that we need to look at while if you have constipation is to check on the fiber intake. Consuming more of cooked vegetables, maybe one or two fresh fruits in a day along with your soaked nuts, having wholesome meals with whole grains. In fact, if your appetite is low because of the treatment, you would have simple one pot meals like a dal khichdi, like a moong dal khichdi with vegetables. That would also be a very good option to keep up with your food intake, your fiber intake in terms of your vegetables. At the same time, keeping it easy to digest as well. The other aspect that we need to look at is movement. It is very, very important, to keep up with your movement, to also avoid constipation because it's only when you move is when your gut will move. The peristalsis would be much, much better, if you move, if there is movement, and that will help with better bowel movement. So keeping up with, being active, keeping up with your step count is very important. Uh, the other, like a remedy that you can use for constipation is you can take about two soaked dried figs or maybe 5 to 6 overnight soaked black raisins along with the water in which they are soaked in the morning. Or you can also try having a teaspoon of organic A2 ghee or pure castor oil, with a glass of warm water for about 3 to 4 days, not more as well. Do not do it like very, on a daily basis as well. But that is something that you can, try as a remedy for constipation. Coming to diarrhea, wherein there are frequent watery stools as a side effect of your treatment. The first thing that we need to look at again is the addition of a probiotic. Maybe here you may require it in supplement form, but you need to check with your doctor, for a reliable and for a good probiotic that you can have. In terms of food, you can follow something called as brat diet, wherein you can keep up with. You can include banana, rice-based food, apple, peeled apple is what you can have. If you have diarrhea. So basically, to keep up with easy to digest meals, while you have diarrhea or frequent motions for that matter. In fact, to bind your stools, you can use arrowroot powder. Take about a tablespoon of it and make it into a paste with water, with hot water. And you can have that about 20 to 30 minutes before your meals to help bind the stools well. Also, since there would be frequent diarrhea, watery stools, it's very important to keep up with hydration and to restore the electrolytes which are lost due to the watery stool. So you can, either have the simplest of, electrolyte waters, which is add a pinch of salt and jaggery, organic jaggery, and lemon to water and sip on this water. Or even coconut water can help restore the lost electrolyte. Next, we can talk about, nausea and vomiting. It is the most common, side effect that we see when it comes to chemo or radiation as well. So, as a remedy, one may try to chew on fresh mint leaves. Fresh, well-washed mint leaves is what one can try for nausea, vomiting. Even, mixing a teaspoon of fresh ginger juice with a teaspoon of fresh lemon juice and having it with a few sips of water before meals or licking on a lemon wedge or having freshly brewed ginger tea, wherein you have like an inch piece of ginger, mashed ginger piece, and boil it in water, and have it as a concoction. That also helps quite a lot when it comes to nausea, vomiting. Even chewing on a teaspoon of fennel seeds, which is soft, or ajwain and jeera, or even cardamom, sucking on cardamom helps a lot with nausea and vomiting. So one may want to try this if you do have this as a side effect. The other gut issue one may face is acidity. Again, acidity could be because of the treatment and because of the drugs that they are on during chemo or even during radiation for that matter. So one of the simplest remedy to help with acidity is lemon water. Now some may feel, oh, lemon is quite acidic, but no. Once you add lemon juice to water, it becomes quite alkaline, and hence one may try having lemon water, that is lemon squeezed water, in which you squeeze a few drops of lemon in a glass of water and sip on this first thing in the morning, and also about after 30 to 45 minutes of your meals. That also helps quite a lot when to deal with acidity. Also, the other thing to consider is you need to avoid tea or coffee on an empty stomach or first thing in the morning, because this will in fact aggravate your acidity further, having tea or coffee on an empty stomach. So let us avoid that completely. Next, as a remedy is, we may try having sabja seeds, which are called as takmaria, or the sweet basil seeds, those white, those black color seeds which swell up when they are soaked in water. They help cool the system a lot, and they help cut down the acidity as well. One may, add about a teaspoon of these sabja seeds in water and sip on this intermittently. Even eating cucumbers, like peeled, well-washed peeled cucumbers, or even drinking coconut water can help, deal with acidity. The other important aspect to look at is to avoid giving longer gap between meals, because that can also aggravate acidity. So having, small, frequent, easy to digest meals with a gap of about say 3 to 4 hours is good to go. Okay, so these were, all the gut issues, most of the gut issues that one may face as a side effect of cancer treatment, and how one can handle it in a much better way. In case of any queries related to this topic, or to know more about our cancer care programs, do visit our website www.coutinho.com. Thank you. Take care.